Mr. Speaker, we are engaged in what is called an historic debate over the issue of health care reform, and there are a couple of issues that need to be addressed. The area that I represent in northern Illinois, the biggest city, is at 19.7% unemployment. Add 7 percentage points to that, it's nearly 27% unemployment. It's incredible. The state of Illinois is laying off teachers and social workers, people involved in all types of social services, students at a nearby hospital or high school went out and picketed because they're concerned over the loss of their advanced placement classes. And yet, under the Senate bill, millions more across the country would be added to the Medicaid rolls. The state of Illinois, already bankrupt, billions of dollars in debt, would have to take on paying an additional $400 million a year in federal mandates and unreimbursed increased Medicaid expenses. This doesn't make sense. And on top of it, there's a 2.5%, we think that's the amount, excise tax on medical equipment, medical devices. You know, the very equipment that was used to save the life of my wife, who came down with cancer 4 years ago, the titanium brace that replaces one of her vertebrae, the radiation machine, all the latest equipment, a tax on the very equipment that's used to help people get excellent health care in this country? We're not quite sure which equipment would be taxed or which would be free of tax, but you know, once the tax starts, and we all know what happens with the tax, it's passed on to the consumers. And so here's this monstrous bill from the Senate that the House is supposed to adopt by some type of unique process that's going to tax life-saving equipment. I mean, it just defies logic as to why this is being done. $500 billion in tax increases. Now Social Security would apply to dividends, interest, capital gains taxes. Tax after tax after tax, hurting the American people. I never thought that it would happen in America when life-saving devices would be taxed to increase the cost of the people who use them. This isn't what the American people want. It certainly isn't what they deserve. There are many ways to bring down the high cost of health care, through association health plans, through meaningful medical liability reform, through increasing the number of community health centers, by allowing small employers the ability to have the same tax breaks that corporations do when using their money to buy health insurance premiums. And America watches and looks and wonders and asks this question: why are the leaders in Congress doing this to us?